Ivan here is the latest recipient of our win-free Lasik competition at Clemson Eye. And here we are preparing to do his Lasik surgery at our Greenville Laser Center. He's already had the flap created by the femtosecond laser, and so now we will lift the flap and perform the laser vision correction. The flap has been created but still is attached to the underlying cornea and needs to be gently separated. Here we're using a small instrument just to identify the edges of the flap and gently score it for 360 degrees, and you can see that it is hinged at the top part of the flap. We'll now use an instrument to gently separate the flap from the underlying cornea, and once we get that separation, we'll reflect it backwards where that hinge is to reveal the mat-like corneal stromal reflection. Now the laser will be applied, and the laser tracker will identify the pupil and maintain the central ablation on the cornea over the pupil with a very fast tracker that will track any small eye movements that Ivan may make while the laser is being fired. The amount of laser energy depends on the amount of correction, but once we're completed, the laser stops. We'll gently hydrate the cornea and replace the flap with a small instrument. We can irrigate under it slightly with some fluid, and then we'll take some soft sponges to gently smooth out the flap, releasing any water underneath the flap so that it will seal to the underlying cornea. Additional sponges are then used to make sure the flap is well centered and that it is smooth without any creases or wrinkles, and that all of the water underneath the flap has been gently squeezed out. This allows it to heal in place securely, and as the days go by, that adherence will become stronger and stronger. It is, of course, vital not to rub the eyes or the eyelids over the first 2 weeks or so, because even direct pressure like that could dislodge or wrinkle the flap. Once that's completed, we can add some antibiotic and anti-inflammatory eye drops and remove his eyelid speculum, and then perform the exact same procedure on the second eye. After 10 to 15 minutes, he is finished with another successful Lasik procedure at Clemson Eye.